Health is also a target. People want health data. The traditional triad for cybersecurity is confidentiality, integrity, and availability. Now, arguably, to deliver your healthcare, your data doesn't have to be confidential. In terms of AI in general, again, I'm in favour of teaching people what it should and can be used for and what it's not so good for. Is it the content that best represents you or your organisation? Probably not. There's a difference between creating it from scratch and modifying the AI-generated content. So we still need both.
AI companions being used these days, and then that's a rabbit hole. And I went through that rabbit hole in terms of researching it and saw quite a few documentaries on that. And people who are at higher risk are people who are already very introvert, or have some intellectual disabilities, which amplifies that further isolation at much larger scale of more faster because somebody's interacting with this AI companion, and within 6 or 9 months that becomes reality.
Have conversations with your children. Make them realise that once you put something into ChatGPT, for example, the data's there forever. You can't take it back. Because AI won't replace most human-generated thoughts, but it should be able to augment them and extend that capability and maybe do some of that basic grunt work quicker so you don't get stuck in that research bit and you still need to validate.
Before we get started, please subscribe so that you never miss an episode of our cutting-edge contemporary conversations. Thank you.
Welcome, Helen. How are you?
Very good, thanks, Dev, for a Friday.
On a Friday. Yes, it's a good day to have these conversations. It's more light and it flows easily. You're not in a hurry.
When the sunshine's coming for the weekend.
Yes. You've been doing cybersecurity work or on the tech side for long, but I'm very keen having that conversation on that side. But before we go there, can I ask you to give a bit of a background and a story and your experience in terms of you landing into the health department and then doing this tech role or cybersecurity role?
You can. So I come from the far, far, far north of New Zealand. You can't get much further north. And I somehow got into technology over 30 years ago. And cyber wasn't really a thing then. Just being able to use things was a thing then. We used to walk to the bank every day and get printed bank statements and use a ruler and type receipts in and things back in those days. Since then, I've worked in a number of large projects and programs, whether it be developing custom software, implementing enterprise resource planning systems such as Oracle, or doing digital transformations and significant uplift programs. Done some work in banking, finance, superannuation, as well as the not-for-profit. Banking, of course, had significant cyber obligations. It's heavily regulated. Health is also a target. People want health data. So the first time round I was at the health department, I was working on reconfiguring lots of things, including technology to support opening a new hospital, which was originally going to be paperless and then paperlight. And you may have seen the news this week that the digital medical record has finally gone live across the state for Western Australia. That's around 14 years after I first started working in health, and I'm back for my second go round. This time I've worked through a pandemic, including having paperless clinics for being tested and getting SMS results, which was the first time ever for us. And those all had cyber things to worry about. Implementing Wi-Fi through 4 hospitals. Some of them are heritage listed. So going from, heritage listed to having Wi-Fi for everybody was a huge thing at places like Royal Perth. And now creating the cybersecurity function for East Metropolitan Health Service. So I started about 2.5 years ago and have built it from the ground up. Tools, resources, people, processes, the interfaces to other organisations, partnerships, procurements, contracts, how are we going to do these things, how do we work with other health service providers, the system manager, health support services, what does and doesn't work for us. Healthcare is not all Windows. There's a lot of operational technology, a lot of biomedical, a lot of Internet of Things. It's not as simple as a corporate environment, if you will. And noting again the age of some of our infrastructure, it's a pretty niche place to have to set it up from scratch.
And the variety of, as you said, the Internet of Things is got a lot of hardware from different countries, and because you want to have the best of the best. And how does those new technology talk to your systems?
Yeah,
that'll be the minefield.
It is. It's quite tricky to navigate, and of course, you've always got budget at the back of your mind. You can't just go and buy new for everything, so you have to prioritise. How do you get the most that you can, and when is enough good enough? When do you need more? When is a device able to be protected through compensating controls or mitigations like firewalls and locking down the traffic that it can send between other endpoints, versus when do you actually need to update and replace the device?
Wow. I wanted to a bit more elaborate on I think you just hit onto that, but still a bit more on the complexity of how is health different than a general professional services business? Running, doing a technology plan or a strategic roadmap from a technology point of view, and because health data is very important and then should be secured in all ways and forms. How does thinking differently, and then what's the mindset?
So in health, and some people will have heard me say this before, the traditional triad for cybersecurity is confidentiality, integrity, and availability. Now, arguably, to deliver your healthcare, your data doesn't have to be confidential. If your data's been leaked, as long as we've still got your data, we can still treat you. Reputationally, it's bad. You won't be happy with us, but it won't necessarily impact the treatment and the care and your outcomes. The availability is very important. Obviously, we would like to have your information available. However, integrity is probably the most important, because it might be available, it might have been breached, but is your information that I'm seeing when I'm making a decision your information? Or is it someone else's? Has it got the right allergies? Has it got this? Has it got that? And what do you do? Do you wait while you investigate an event and confirm it's an incident? If the integrity of your health data is in doubt, you actually need to act far sooner than what investigating a potential incident may allow. The other complexity is the age and variety of technology. So patient monitoring, wearable devices are more and more common now. You've got watches that can tell you observations. They can tell if you've had a fall. We can put things on you that will send readouts to various places. It's meaningless if nobody's keeping an eye on it, or the data isn't being appropriately checked and triaged and prioritised, so that if we've got 100 people's observations, do they get looked at in the order they come in, or do we have some parameters that kick some up the tree so that a nurse looks at that one first because that one looks a bit odd? And that's where some of the machine learning, artificial intelligence, and the ability to augment human capabilities comes in to improve potentially the speed that we can intervene in providing patient care. East Metropolitan Health Service has done a lot in that space since 2019, when we first started remote monitoring. We now offer that service both at our hospitals and other hospitals around the state, but also in aged care facilities. And it's expanding exponentially, and it is enabling far more people to be monitored and have things looked at than traditionally if you've got someone having to come around manually and take observations every X hours.
With that many people in the state and so much data points being gathered all the time, data and data servers is a big thing. Does the health departments keep things in-house or have worked with third-party servers?
So
how do you manage that complexity?
We do both. It depends on what it is and the volume and how long we need to keep it for, what we want to do with the data, how quickly we need to be able to access it, all of those kinds of things. So we have common use arrangements, we have enterprise agreements, most of which are negotiated at a whole of government level that we're then able to access and use. We have our own team of data scientists, so you can imagine some of the things that they might do. And we have strategic partnerships with other organisations such as Curtin for their supercompute capacity as and when required. And we do a lot of things where we might just try it and then decide that's not actually doing what we thought it was going to do, and we move on quickly from there.
People understand cybersecurity very differently in the whole spectrum, whether it's whole of government, whether you are running a small business, whether you are a doctor running a clinic versus running a hospital. So the understanding of cybersecurity is fairly different. And how do you have that lens in terms within the organization, and how do you get people to understand and educate the whole the workforce?
I think that's a really important point. Education and awareness, achieving a cultural shift and bringing it into the forefront of their minds. I'm not a fan of blocking AI or generative AI or agentic AI. I believe that it's more important to teach people, to give them useful information, to tell them, for this use case, use this product. For this use case, that product's not so good. How about you look at this one? And these ones we just don't use because there are either federal no-nos on those or things that make us have concerns about what you might be doing and where the data may end up. So AI is one aspect of the education and training that we provide. We also do regular tabletop simulations, incident response simulations, and we have big campaigns about things like phishing and also stuff that you can take home. So how do you keep your home devices safe? What do you have automatic updates turned on your mobile device? Do you use multi-factor authentication everywhere it's available? What does a strong password look like? And we can tell people why. We can use things which are unfortunately all too frequently in the news. You know, Qantas, Medibank, Optus, Leonard's Chicken, Domino's, the list goes on.
Almost everybody.
Yeah, pretty much everybody. So it's if you've got this information, here's how you keep it safe. If you get told your information has been breached, here are the steps you should take. Don't reuse passwords, don't do this, and also have conversations with your children. Make them realise that once you put something into ChatGPT, for example, the data's there forever. You can't take it back. From
the point of view of people who are, what do you see? There are these cars which you use, which are already EV cars, which are connected all the time, every time, with audio and camera both set up, and it's permanently active and on. And I was listening to one of the Senate estimates, federal, and one of the newly appointed Home Affairs Minister was using an EV.
Tony Burke.
And then he was traveling to defense locations, and the cameras are on all the time. And it was a Chinese-made vehicle, so it was again those kind of decisions to be taken consciously. And how do you see those things to be aware of for people at multiple levels of government as well? So, you know, for the last 20 odd years, if you turn up to a prison, you have to leave your mobile device at the front. If you go to the regiment, no mobile devices, definitely no EVs where they go. I would imagine that most critical infrastructure entities, and we are one, will be moving to mirror the federal obligations in that regard. However, more to the point for everyday people, so forgetting the regulations for critical infrastructure and for the government, robot vacuum cleaners are actually one of the biggest domestic threats in terms of identifying places to target for burglaries, because most of them don't have any security. They can be easily hacked. They post things on the web of people walking around their house thinking they're in private, but they're not. And there's a live stream of them somewhere available on the web.
So people need to think about these things. Their Ring doorbells, all of these things are personal considerations as well as the work ones. So yes, for defence, for hospitals, for other critical infrastructure entities, there will be probably coming some fairly strict rules about where EVs and particular makes, what types of switches and modems you can use, all of that. I mean, you already can't have certain applications on government issued devices under both federal and state policy.
And which means in the aged care sector, again, on those facilities, you will have camera devices and, face recognition devices. There are people who are using wheelchairs which are connected to the internet. And how do you, again, they have cameras installed and audio installed as a default. And when the facility is a multi-resident facility, and one person is using that tool, but everybody's get exposed to that and those things.
This is sadly true, and it would be along the lines of when you get your new modem or router from your internet service provider or you buy your own, do you go and change the default credentials so that people can't just log in by looking on YouTube or Google to find out what the default creds are to get into your modem? So similarly for those, I would imagine residential facilities will start having rules and regulations about which ones can and can't be used at their site. And if they are going to be used, here are the guidelines in terms of you have to have changed those passwords. It's restricted to being on the local network. It doesn't have internet access, that kind of thing, which means they're going to need some tech-savvy people to be able to lock that down.
Can you also talk about your department as you within the health, the cybersecurity? How has because you were the first person, how have the evolution of the department, the scope of works has expanded, and what does that journey look like for you?
So when I started, there was just me, and I needed to figure out what I needed the team to look like, what we were going to do, what were the highest priorities. So along with evaluating some tool sets and talking to some others in other industries, I started putting together a strategy with various horizons for the first 5 years. And that included building the team, resourcing the team, did a business case to get some funding and resourcing for the things which I thought were the highest priority, and then started implementing once those approvals had happened. So we've gone from me and nothing to having a range of tool sets in place and a team of 9, predominantly focused on the things which are our responsibility to look after in the OT biomedical space, looking after what's on the network, and education and awareness. It's a very important part, along with governance, risk and compliance, because as a state government entity, we have a number of regulatory obligations that we have to comply with at the state and Commonwealth level.
And what have been the learnings and findings in terms of, the evolution of, from horizons to horizons, and how the public services is, growing and expanding with that, and then what are the risks you can see?
So we have over 10,000 staff, and I think for a lot of people, when they hear cyber, they immediately think technology and geek and coding, or a hacker in the basement in the dark wearing a hoodie with numbers all over the screen. A large part of our work is actually education and awareness, and making sure that people know what the right thing is and how to make it as easy or frictionless as possible for them. We're not here to be the house and know. We're actually here as a support and enabling service to help you get things done. So if you want to buy a product, if you have an initiative you'd like to do, we want you to come and talk to us at the beginning, because we may be able to offer some additional options to you that you may not have thought about. Whereas if you go all the way down the path, by the time you come to us, you may have already eliminated some of those options because we haven't had a chance to have some input and talk to you about what your use case and your business requirements are earlier. And we spend a lot of time helping people navigate some of that in terms of all of the rules for procurement and the policies and things. So you can't just walk out and go to JB Hi-Fi and buy something. You can't just order something. And if it's got data, if it's got something which interacts with a patient, there's various things you have to consider and choose and make some, hopefully good decisions about.
And is there a pathway for AI being implemented? Is a third-party AI, or is there a pathway to have your own AI in-house?
Both. So third-party AI has its uses when you're doing general research, when you're trying to compare things. If you don't want to go off and look at the offerings from a vendor and this vendor and that vendor, you can get a pretty quick idea if you use the right kind of prompts and the right product through generative AI. However, for in-house AI, all of that patient data, what are you going to use that for? And you can't really use third-party AI. You need to contain it because it is private health information. It is personally identifiable information and it is sensitive. So the use cases for that may be research. It may be actual making decisions or prioritising people for particular types of intervention at a point in time. Or it might just be you're trying to figure out whether this data could be used for something. And then you have to work out what the consent requirements are for that. And if you try and use it for something and it doesn't work, do you need to then tell them that, oh yeah, you said we could use it for that, but it doesn't work, so don't worry, we're not doing that anymore? Where does all of that start and finish?
So which means if there is an in-house AI, you are setting up the whole in-house infrastructure around it, and then is it implemented, or are you still going through the phase of purchasing the whole data centers and GPUs and all of that stuff too?
So it depends on what we're doing. So for very small scale stuff, we do have our own that we can use now, and we need to do some further investigation about partnering versus just being on our own in terms of the larger options.
And in terms of because a lot of people in the front line, in not just in healthcare but the care sector broadly, people are, and as you know, one of the way to get government and state funding or federal funding when you're delivering any form of care work, you need to have case notes. So people in the front line might be trying to use ChatGPT or any AI tools to write case notes because that's part of the evidence to prove that I've delivered that care. And how does AI governance become more effective rather than just being a policy piece on the platform?
So there's a lot of transcription tools out there now. You have to remember back to what I said earlier in terms of some of our infrastructure being quite old. Transcription tools aren't necessarily that effective in a very busy emergency department where there's a lot of voices talking at the same time. So again, it's what's appropriate for this particular use case kind of scenario. So if you're one-on-one with your GP in a room, all of them might work fine. But if you're in a theatre or an emergency room where they're not individual bays, they've just got curtains in between them, some will be more effective than others. So it's not just the governance and the policy side of things, it's actually what's fit for purpose.
And in large organizations and in public service again, how do you have the same conversation together as in one breath of AI and cybersecurity together? What are the overlaps, and then what do you see the key thing? Because there are many organizations who are going onto the journey of AI, and there are people who are employees, they are using AI on a regular basis without being, notifying the employers.
So I'm sort of lucky and privileged in that we have somebody on the state advisory group for AI from our organisation. and he used to be my boss. So we work together quite well. That is not necessarily the case everywhere. And he also knows that I am not someone that just automatically says no, that we can have a conversation and talk about what the benefits are, what the risks are, what we could consider what's absolutely off the table, and what we could have a look at together and figure out if it's a yay or a nay. In terms of AI in general, again, I'm in favour of teaching people what it should and can be used for and what it's not so good for, and which of the products are going to be the best for their particular use case. We've all seen the LinkedIn posts, heavy emojis, the long dashes, the superlatives, which are not really needed. And if you're going to use generative AI to write a job application, don't just submit what it spits out. You need to have a look through it. You need to change it. You need to contextualise it. You need to make sure it's actually reflecting you and your experience. And they are pretty easy to spot.
What do you think is the right age to introduce AI to young people?
That is a hard one because age doesn't necessarily equal the same kind of things for genders or skill sets.
You're right. Because we're doing a social media ban happening soon, but in the coming age, one needs to, it becomes a tool. You need to learn these things, as you talked about, education and awareness. And that should be one of the skill set one should come out when they finish at least the year 12.
So a real basic one, if you read a few books and you love some and you hate some, AI should be able to tell you on that basis which ones you will enjoy reading, noting, of course, that just because you hated reading something like Lord of the Rings when you were 10 doesn't mean that you won't like it when you're 15 or 20. So there are some really basic...
That's a Kiwi reference. Fair enough.
It is, and same with TV. I mean, ChatGPT can tell you if you like this show, this show, this show. You'll probably like this one. But your streaming service already does that for you.
Yeah.
You don't need to do it.
Yes. And another, from a mental health angle point of view, there are tools like AI companions being used these days. And then that's a rabbit hole. And I went through that rabbit hole in terms of researching it and saw quite a few documentaries on that. And people who are at higher risk are people who are already very introvert or have some intellectual disabilities, which amplifies that further isolation at much larger scale of more faster, because somebody's interacting with this AI companion, and within 6 or 9 months, that becomes reality.
Yeah, it's like the algorithm and the confirmation bias in your social media feed. Whatever you respond to, it gives you more of, depending on what it is and how socially responsible it is. They can be quite dangerous. I don't know if you've ever tried, as part of your research, to break a large language model or poison a model, or go into Dan mode and ChatGPT with the guardrails off and see just where you can get with that. And all of these are educational, but it's very different if you're doing it for research versus if you are a vulnerable person. And it happens, sadly. The other side of that is, it's the next step, it's the evolution. So 10 years ago, teenagers were starting to use MacBooks at high school, and they were still doing their exams in written format. Now, when you type a document in Word, you can cut and paste, you can move it, you can change the order, you can do things. Versus when you start
writing
from beginning to end, it's a different skill set. And AI will be the same. So AI can create content. Is it the content that best represents you or your organisation? Probably not. So there's a difference between creating it from scratch and modifying the AI-generated content. So we still need both, because AI won't replace most human-generated thoughts, but it should be able to augment them and extend that capability and maybe do some of that basic grunt work quicker, so you don't get stuck in that research bit. You still need to validate.
And when you finish your school education, you go to university and you start, be an intern or a trainee, and then you slowly build your experience up. But now I have 20 plus years of experience, but there are people who have helped me and told me this is wrong, this is right. When I was a trainee and I was told, okay, go and do that research and come back and write a paper on this. And I would go out and spend time, and then they will tell me this is right, wrong, redo it. And the act of researching and doing, the 20 years of experience is of that now you know what is good, right or wrong.
Yep.
The young people who will graduate now, and if the entry-level roles will be gone in the next 4 or 5 years, that opportunity for young people to be mentored or coached by their bosses, that will be gone. How do you create that layer of understanding that what to know what's right or wrong?
So I don't think entry-level jobs will be gone in all cases. So, for example, nursing and medicine will still be there. However, I do agree that in terms of some of the more basic admin type functions,
accounting,
all of those. So it's going to be a conscious choice by organisations. It is already as to how many of them will take in an intern or a grad and run a program for them. Not everybody does it. My team was lucky enough to have a couple of interns recently from the McCusker Centre at UWA, and it is an investment because it does take time, but it is something, especially in the public sector, we're known for. We do that. Private sector, the big organisations do. They run really fantastic grad programs and internships over summer, etc., etc. I don't actually see that changing because of the value that the organisations place in those investments. So the entry-level jobs may not be there, but those opportunities for coaching, mentoring, they should be there, and industry-specific ones. Australian Women in Security Network, AWSN, they have a mentoring app which matches people in cyber all around the country. It doesn't have to be in person, it can be virtual, and you can have a couple of sessions with one person, or you can have a regular ongoing thing with several. It just depends. It's what are you willing to give back to your community and your profession, and what is your organisation prepared to do. And I think that will continue, and it will expand into when is it and is it not appropriate to use AI, and what should you be considering when you're thinking about that.
The health department interacts with a lot of other government entities, and across all state and federal also on a regular basis, because things like NDIS is also there's all federal schemes in which the health interacts, and then every interaction creates a fragile point of data moving and coming back forward. And how is that hyper complex environment managed and understood and then delivered?
So it depends on what it is and who you're dealing with. It's no different than a lot of inter-agency, inter-organisation dealing, whether you use the G Suite or whether you're a Microsoft shop and you use Teams and SharePoint. There are safeguards in place where you set up those connections so that you can communicate between organisations. But let's face it, we've always been able to print stuff and mail it or fax it or forward a document via email, and people's stuff gets auto-completed in the email and it goes to the wrong place, not on purpose, or people do it deliberately because they can't be bothered doing it the right way. And that's the bit that I focus on. I don't want people going around the rules because the rules make it too hard. I want it to be easy for people to do it the right way. So if you are in Canberra and you are sending me a document and you want my feedback on it, it's my responsibility to respect that document and not circulate it outside of where it's supposed to go. I should store it in the appropriate place. how do we make sure people know that so that they understand the obligations on them? And how do we make them care about it?
That's a bigger one. How do you make them care about it? That's probably a mindset shift.
It is. It's cultural.
And then how do you do a cultural shift at an organization 10,000 people?
Correct. Especially when the vast majority of them are supposed to be there focusing on delivering frontline patient care. And if you come into our emergency department, you want to be treated by a nurse, a doctor that has qualifications, skills and experience in emergency medicine. You don't want me treating you. So when it comes to cybersecurity, you don't want them having to think very hard about it. You want us to have set the environment up in a way that's simple for them to navigate. It's the same, just in reverse, and it's a newer concept.
In terms of the next, because things are moving a bit faster on data, and data requirements are increasing and expanding ever so at much faster rate. So what do you see in the next 5 years, the bigger pieces of projects as a state government need to overtake from a health point of view?
So we've finished the digital medical record. The electronic medical record is next. So the difference between those two, one is a static image, one is actually live data being input. The other side of that is we've got a whole heap of new infrastructure expansions, changes, whether it be the emergency departments, the new women's and newborn. So what are the tech components that go with that, and how do we develop them so that they're not constrained by our existing infrastructure, but are also able to interface with our existing? Because we don't want to be left behind on the tech front. We want our community to have access to the best and brightest new things, but we also don't want it to be in isolation of everybody else. And how do we keep it equitable for regions, remote communities, women's and newborns versus mental health versus aged care? And those are all tricky discussions and thought processes to go through. So I'm glad I'm not a politician. The other things would be people wanting control of their own information. So when you come in, you can choose to sign up to My Health Record or not and have your data automatically put there. But what other choices are you likely to want in the next 5 years? Because at the moment, health data is becoming a deliberate target for bad actors. It is also something that we don't have the option about keeping. It's different to having the right to be forgotten. Because we need it to be able to treat you, we actually have to keep it even after you die, because your family may choose to sue or something like that. And so how do you balance the wants of the individual to limit the amount of their data which is held, because that reduces their personal risk, versus our obligations in that regard?
Wow. I want you to conclude with your views of just for an person who's running a small business or a medium-sized business. What are the things they need to be worried about from a tech/security/AI point of view, or conscious of?
So small and medium business, it's really challenging because nothing that is free is actually that secure. If the product is free, you are the product, essentially. How do you keep your information safe enough, and what is safe enough depending on the nature of your business? What information do you keep? What information should you keep? What are you obligated to keep? And how often do you clean it up and get rid of or archive, that kind of stuff? How do you get any assurance that what you're doing or the service provider you're using is doing it the right way? So for me, there are places like, remember when Xero and MyOb came out for accounting? We need similar for cyber, for small and medium business, where you go to a managed service provider and they do all of that for you, and you can get independent assurance and verification that your monthly subscription that you're paying these people is doing everything it says on the box.
Thank you, Helen, for your time today.
Thanks, Dev.